So what should be done to this patient? Next, so we have a diagnosis in our mind, that is peptic ulcer, mostly in the duodenum. So the next thing is to confirm it. Okay, so what is the diagnosis, what is the investigation to be done to confirm this, like whether he is having a bleeding peptic ulcer? That is upper GI endoscopy. So that is the next step in the management. So we have to do an upper GI endoscopy, confirm your diagnosis, then you have to give the treatment. Okay, so treatment means if the bleeding is severe, you have to give something for bleeding. You should give some iron tablets to improve his HB. At the same time, you should be given drugs like proton pump inhibitors or H2 receptor blockers as a part of treatment of peptic ulcer. So all these things should be done, and he should be advised not to take NSAIDs regularly. That he should be advised why he is getting the peptic ulcer. He should be given that information also. Okay, so now I will show a video of upper GI endoscopy. So when the endoscopy is done, they can visualize the lesion, as well as if there is something which need to be confirmed, again they have to take that for biopsy, and histopathology study should be done. So this video will be showing how this procedure is done. So again you will be learning about these in your higher classes, you might be seeing it, but this is just an exposure to clinical site. Okay, so whatever the surgeon is holding, this is the endoscope. Okay, and whatever he is having in this hand, with that he can adjust its focus, everything can be done. So upper gastrointestinal endoscopy or upper GI endoscopy, you can visualize the GI tract till the second part of duodenum. Okay, so esophagus, stomach, first and second part of duodenum can be visualized. Okay, so they are keeping, you have to observe here. As I have been telling for other video, you should know what you should be observing. You have to observe here, patient is in left lateral position, and then they will be keeping a mouthpiece. Through the mouthpiece they will be introducing the endoscope. So this endoscope is having camera. Okay, so whichever portion it is, you can see that in the screen. Okay, you will be seeing all this here now. And then what is kept here is lignocaine jelly. Lignocaine is a local anesthetic. Okay, so the initial part, the tip of the endoscope, they can apply that, because when it is passing through your pharynx and all, they will have that gag. Okay, so to control that will be applied. So you can see here, so they have kept the mouthpiece, patient is in left lateral position, and the gastroenterologist, he'll be introducing the endoscope through the mouthpiece. Okay, so while he is introducing, he can visualize that area here in the screen. Okay, okay, so as the scope is progressing, here you can visualize the GI tract. So they have reached epiglottis. So again I will show a slide showing the procedure, like steps that you can read it if you want. Oh, this is esophagus. You can see here in the screen that areas will be changing. So you are seeing the stomach here, rugae of the stomach you would have learned in anatomy, right? So you are seeing the stomach here. So now when you are seeing the gross specimen of stomach, you would observe that rugae, right? So the scope is now in the stomach. So as now it has progressed into duodenum. Okay. Next, in the same video they will be showing how a biopsy is being taken. So they are introducing the instrument through the scope. Okay, so and the tip of that there is forceps. Okay, so with that how they are taking, see, this is the tip, artery forceps. Okay, so with that they will be taking a biopsy also through the endoscope. See this instrument, this one. So they'll take a pinch of the, if they are having a lesion which like some suspicion is there, they have to confirm that it's not malignancy. So they'll be taking biopsy. Now he is withdrawing that. You can see that they'll be putting, see, this is the specimen here in the tip of this. So they'll be introducing this into a specimen bottle and they'll send it for histopathology. So he has introduced that instrument into that. See this small thing, this is the specimen. Okay, and the video will show where there is, you can visualize the ulcer through the endoscope. Okay, so again this is another video. So in the pyloric region there is an ulcer for this patient. And again you can see the rugae, which means the scope has entered stomach. So ulcer means it's an excoriation of the mucosa. See, this is a big ulcer. Okay. Okay, so you have seen endoscopy. Now we'll again show another chart. Okay, before that I'll show the procedures of. So this is the procedure of upper GI endoscopy. You can read about. This is just an information. If you want, you can read it. Okay, again you will be seeing all this. Probably you'll be seeing all this in the coming years. Okay, so you can read this over. Who's interested can read this. Now I'll show another case chart. Okay, of the same condition, and just to give you a like how a clinician will be seeing the case, just to get a feeling of that. Okay, so like how we do for clinical examination. First thing is biodata, and then history taking, then examination, investigations. So you'll get a diagnosis. First you'll have a differential diagnosis. If you need to confirm, you'll take investigations, and then you'll give the treatment. So biodata is a 55-year-old male. By occupation he is a bank employee. What is his complaint? He is having abdominal pain for 2 to 3 weeks. Okay, and pain is relieved on food intake. So what is the thing coming to your mind? He might be having a duodenal ulcer, and he has history of smoking, and he drinks alcohol in moderation. Okay, so both things can predispose to ulcer. Okay, so on general examination, this is like no pallidrector, cyanosis, clubbing, edema, and lymphadenopathy. Okay, so these are his vital signs. On examination of GIT, there is diffuse tenderness, and there is more tenderness in the epigastrium. Okay, you know what is epigastric region, right? The part just above the umbilical region. The other system examination like CVS and RS is within normal limit. Okay, so what is your probable diagnosis? Peptic ulcer, because his history is suggestive, and when you are done examination, there is tenderness in the epigastric. Now usually for this kind of presentation, like just 2 to 3 weeks complaints and having just pain, only pain, at this point itself a clinician will be giving the treatment. He may not go for any investigations. Okay, but suppose the patient is having this for like months, or you have given this treatment and it is recurring again and again. In that case, you will be doing investigation. Okay, so I'm again repeating, just for this case, normally no one will go for GI endoscopy. At least for 1 week you can give medication, you can see whether it is improving. Okay, but to make you just to tell you, if it is repeatedly coming, if it's recurring, these investigations can be done. Okay, so what is the confirmative investigation? It is endoscopy. So you will be seeing ulcerative lesions in the duodenum. Again, when the surgeon is seeing the ulcer, if he is having some suspicion, he can take that for biopsy. So once the result comes, if it is just peptic ulcer, what treatment you should give? So what is the diagnosis? Peptic ulcer disease. What treatment? Tap pantoprazole. It is a proton pump inhibitor. So again, how to write prescription and all you will be learning next year in pharmacology. This is just an exposure, that's all. Okay, so usually Pantop is given OD, and Pantop is a drug which should be taken half hour before food. Okay, so that can be given for 1 week. And then syrup sucralfate. Again, you go and read your physiological basis of management, you will understand what is sucralfate. Okay, it's a syrup, 5 ml TAD. Sucralfate is a drug which should be taken after food. Okay, it can also be given to 1 week. So usually the symptoms will subside for the treatment for 1 week, but at the same time he should be advised to stop smoking and alcohol intake, because these things can again, he will have a recurrence if he is not controlling the predisposing factors. And to avoid spicy foods, regular exercise, yoga or meditation can be done, because if he is having a stressful life, that will control that. And then review after 15 days just to make sure that he is relieved of symptoms. Okay, so this is the thing. So this reflections you should write in your logbook. You can write my name, date November 8, 2019, classroom setting, EC number 3, topic upper GI endoscopy and peptic ulcer. This will be page number 11 of your logbook. Okay, so like the other topics, again I've seen many of our reflections, only few sentences, 1 to 3 sentences, at least 150 to 200 words should be there. You have seen your logbook format, no? At least that space should be filled. Okay, I know you might be busy preparing for exams, but still like you take this as just a recreation. You can just see some video and write something, okay, which is not so serious. Okay, and I think I also observed that some people are still writing in papers. Okay, so you take printout of logbook so that you need not spend time again to copy that. Okay, and you can write directly in your logbook. Okay, thank you.